Welcome. First, a necessary disclaimer. This video does not constitute any medical advice and never encourages anybody to stop any prescribed medication or turn away from conventional Western medicine. For any health-related questions, please consult your doctor or pharmacist. Thank you. In this slide series, we will explore how integrative herbal medicine may support pain medicine in areas where the current models continue to struggle. Our goal is to expand the boundaries of what we understand as effective treatment, while honoring the successes and scientific achievements of Western medicine. What we are adding are integrative elements, herbal formulas, nutritional strategies, and psychotherapeutic support, aiming to improve long-term quality of life. You will hear terms like physically frozen field frame, referring to a rigidified fascia structure held in place not only by inflammation or trauma, but by deeply embedded belief systems. This frozen frame leaves a digital imprint in the body's hologram, affecting how pain is perceived and processed. To fully understand these ideas, I recommend watching our related videos on chronic pain and field-based anatomy. To understand this model, we must begin by viewing cancer not just as a disease, but as a trauma pain encapsulation, a sealed-off core of unresolved suffering. It often belongs to what Jung called the shadow personality, aspects of the self we have pushed deep into the subconsciousness because we were unable to process them or bear their emotional weight. There it is, hoping one day we will finally turn toward it willingly. But if we don't, it starts to poke us, drawing attention until something in our life forces us to begin the search, perhaps meeting people in our life who can help us understand and digest the message buried inside. This mechanism is surprisingly mirrored by oncology itself in what is known as the Warburg shift, a metabolic transition where the tumor's oxygen and nutrient permeability decreases. In other words, the tumor becomes a sealed quarantine zone. Little gets in and little gets out. It switches from mitochondrial oxidative phosphorylation metabolism to anaerobic sugar fermentation, much like muscles do during lactic acid buildup in the gym. This generates energy, but also free radicals, and not too much energy, a form of internal inflammation that symbolically digests the trauma. So why does not the tumor disappear on its own then? To answer this, we must invite psychology into the picture. The emotional roots of the tumor, such as victim identity, the need to be seen, unresolved humiliation, or inherited emotional patterns, must be addressed consciously. Otherwise, the tumor tends to recur again and again until resolution is achieved. Working with cancer is therefore not just a medical or psychological act or process. It is an emotional and existential decision. Sometimes painful and exhausting, it can also be liberating. It can open the way into a new and better identity. And yes, there is evidence. Herbal medicine may have a supportive role in reducing the side effects of chemotherapy and radiation, and potentially enhancing their efficacy. But this must be done in close collaboration with the oncologist and only between treatments, using formulas specifically designed for mitochondrial revival, immune support, detoxification, and soft tissue regeneration. To understand CRPS from an integrative point of view, we need to approach it differently, not just from nerves and anatomy, but from energy and communication. In traditional Chinese medicine, CRPS is viewed as a meridian blockage disorder. And from an integrative perspective, this offers a useful clinical model, because here we are not debating statistical significance, but matching real symptoms to real energetic patterns. If a model explains the clinical reality better than the textbook, then perhaps it is time to expand the textbook. In Chinese medicine, meridians are not simply lines on a chart. They represent a connective tissue light signal network. They form early in embryological development and serve as a pathway for growth, coordination, and communication. Think of them as the body's bio-internet or internal Wi-Fi system. Every internal organ is connected to its meridian. If, for example, the heart's electromagnetic field is weakened, it is associated with meridian also weakens. That meridian runs superficially in certain zones, like from the elbow to the hand or the knee to the foot. That is why acupuncture points exist there. They are biological entry points into this meridian web. Now back to the CRPS. In these cases, the pattern runs in reverse. Let's take the arm where the meridians of the heart, lungs, and the pericardium all flow. If a person has underlying heart issues, say coronary artery disease, the heart meridian stagnates. And when the meridian freezes, its bioelectrical flow stops. The surrounding fascia locks up, and the muscle becomes spastic, and the structured water system collapses. This creates tension in the tissues and leads to edema, which we clearly observe clinically. It also activates the sympathetic nervous system, triggering signs like cold, sweaty extremities, goosebumps, abnormal vascular tone. It is like a frozen limb, physically present but energetically disconnected, similar to spastic paralysis. Conventional Western medicine often treats this by blocking the sympathetic nerve at the stellate ganglion, an invasive procedure not without risk. An integrative alternative is to treat both the organ and the meridian together. Fascia therapy for the limb, bioresonance as a needle-free acupuncture equivalent, herbal medicine to support both the heart and the fascia, and psychological support because organ dysfunction is never just physical. It carries emotional meaning too. Children, whether neurotypical or on the spectrum, often function as emotional sponges in the family system. In systemic constellations, we call them symptom carriers. And what do they carry? Unprocessed pain and trauma, often from parents, grandparents, or even further back. They absorb what the field cannot express. And if someone is willing to listen, they try to speak through behavior, illness, or emotional dysregulation. If not, their bodies begin to burn with silent inflammation. That's why many families raising autistic children face buried emotional trauma waiting to be uncovered. from this source of pain, a feedback loop forms. The parent, often the mother, starts fighting institutions, demanding justice, becoming entangled in external conflicts. But underneath that anger, we often find a deep unresolved wound, often connected to the father field. Dad, see me. Dad, why didn't you protect me? Why were not you there? These unmet emotional changes and charges create an enormous energy field, but not all at once. They build up day by day in ordinary life. And the child, sensitive, connected and open, feels that charge accumulating. They experience it as an informational overload, which manifests as ADHD, anxiety, or behavioral crises. Of course, external toxins can further elevate this inflammatory load, pushing the child's system over the edge. But the core issue remains. The child reflects not just their own nervous system, but the resonance of the family field. And in doing so, they offer an invitation, not for blame, but for healing. In traditional Chinese medicine, the heart is not just a pump. It is where we feel. This idea traces back to a time before Sir William Harvey declared that the heart is nothing more than a mechanical device. But many languages, Hungarian included, have preserved a deeper truth. That the heart houses the integrating consciousness, the mind. That it helps us to discern situations, feel gut instincts, and sense who can be trusted. In modern science, there is even a name for emotional heart injury, Takotsubo cardiomyopathy, a stress-induced heart failure that can mimic a heart attack. Often it is accompanied by pulmonary hypertension, especially when the lung field is weakened by unprocessed grief. But this pain often goes unrecognized. Western medicine may label it psychological. Yet the patient may be suffering from real crushing pressure in the chest, palpitations, insomnia, and a vague but terrifying sense of a collapse. Let's go deeper. The heart-lung axis in Chinese medicine is known as the Jueyun system. It includes not just the physical heart and lungs, but the pericardium, inferior vena cava, and the portal vein to the liver. A full field system, not just individual parts. The lung in this system is the organ of upper letting go. We even say he breathed his soul out. The colon, by contrast, is the organ of lower letting go, as I don't give an SHIT. This is why Chinese medicine often treats early stage pneumonia with a cleansing purge, diarrhea, to help both the colon and the lung release what is stuck. Now, why is it relevant? Because when someone suffers a heart pain that is not caused by coronary artery blockage, we should consider the emotional and energetic terrain. Grief, betrayal, unprocessed rage, or soul loss may rupture the heart field and the lung field as well, even just as real as a myocardial infarct. Obviously, if there is a past medical history of chronic dust exposure or smoking, the picture becomes different. But in the absence of such a past medical history, this emotional component should also be taken into account. This is not mysticism, this is field trauma. And sometimes healing the heart means healing how we relate to ourselves and to the world. Phantom pain comes from a limb that no longer exists. By conventional logic, this makes no sense. We say that these severed nerve endings are firing randomly, causing pain. But if that were the full explanation, painkillers would work. They usually don't. So let's look at this situation from another angle. Clinically, one of the most effective treatments for phantom limb pain is the mirror technique. The patient looks into the mirror, sees the missing limb reflected, and pretends to move it as if it were still there. Surprisingly, this often reduces or even eliminates the pain. Why? Let's explore a different logic. Mystics speak of an aura, an energy field surrounding the body. But can we frame this in more modern terms? Yes. If we accept that the brain does not only control movement through the nerves, but also by projecting a hologram of motion into the fascia and connective tissues, then something shifts. The fascia acts like a holographic transmitter, a structure Chinese medicine calls qi, or bioelectric communication web. This is the body's bio-internet, Wi-Fi network. This web creates a movement blueprint, and the nervous system simply follows it. In phantom limb pain, the blueprint is still there. The body may have lost the limb, but the field has not. The digital hologram was not severed by the surgeon's knife. So the brain keeps sending the signal, move. It waits for a response, but none comes. The loop stays open, and the pain keeps firing. The mirror provides visual feedback to close the loop, a signal of resolution, a moment of peace in a system suspended in confusion. What we call phantom pain may actually be field dissonance, a mismatch between the energetic body and the physical map. And when we understand that, we stop chasing the nerves and begin realigning the hologram. To understand fibromyalgia from a different point of view, we need to shift our perspective. This is not a condition with clear lab results or imaging findings. Yet the suffering is real. Widespread pain, exhaustion, insomnia, mental fog. So what is happening? Fibromyalgia may be the result of a chronically elevated inflammatory state, often driven by a mix of environmental toxins, unexpressed, unprocessed emotional trauma, and internalized thought patterns, what some traditions call trauma, toxin, and thought. Let's examine the clinical picture again. Cold hands and feet suggest peripheral circulation shutdown. This can result from thickened blood, called blood stasis or blood sludging, blood slowed down by inflammatory proteins and metabolic debris that clog the microcapillaries and microcirculation, depriving tissues of oxygen and nutrients. You can even observe this at home. Check the veins under your tongue or take a selfie. If they are dilated and thick, it may reflect blood stagnation and inflammation. Lower back pain. It often points to adrenal exhaustion, adrenal fatigue. And with it come symptoms like frequent urination, pale urine, low libido, sugar cravings or emotional eating, immune dysfunction or autoimmunity. All this why? Because in trauma states, the body requires more energy than it can produce. The adrenal glands flood the system with cortisol and stress hormones in a desperate attempt to keep things running. But it isn't sustainable. Eventually the system collapses, the body tries to speak through reflux, through dry coughs, through gut problems like irritable bowel syndrome, Crohn's disease, ulcerative colitis, inflammatory bowel diseases, through menstrual disturbances, often clotted or painful flow. Why? Because microcirculation in the capillaries reflects systemic congestion. If the menstrual blood is clotted, the blood is probably thick and sludged elsewhere too. Chinese medicine calls this pattern liver qi stagnation and liver qi invading various organs, a term we will explore in a future video. But the core issue remains. Fibromyalgia reveals a depleted system trapped in a low-grade inflammation, with scarred fascia and impaired mitochondrial energy production. Western medicine often treats it with steroids, trying to mimic what the adrenal glands can no longer provide. And this works for a while. But it is like whipping a dead horse. A more sustainable approach, perhaps? Use herbal medicine to clear the waste, rebuild the lipid membrane, restore the fascia communication system and flexibility, what the Chinese medicine calls qi flow, and yin, the tissues, and gently reawaken the mitochondria, the spleen, the deep engines of vitality. To understand opiate withdrawal from an integrative perspective, we must first rethink anxiety itself. What makes us anxious? We become anxious when we have strayed away from our path, when we feel out of control, uncertain, lost in a world that seems overwhelming. It is like being a child again, standing alone in a dark room. Addiction often begins there. At first, we reach for the substance. Alcohol, opiates, work, or even the internet, online addiction, because we are anxious. But soon we become anxious because we reached out for it. The spiral tightens, and beneath it all lies pain. Addiction is a form of pain avoidance. We use substances to numb the trauma we feel too weak to face, especially when we feel alone with it. Often the trauma began in childhood, when someone violated our boundaries, when we had no defense, no control. And so, deep down, we live in hypervigilance, always scanning for the next threat. This is sympathetic activation, a constant on mode that drains the already depleted mitochondria. In this low energy state, the body begins to accumulate waste, metabolic byproducts that Chinese medicine calls dampness. To encounter this, the body triggers sterile inflammation, not to harm but to cleanse, to burn away what cannot be processed, and to generate just enough energy to maintain the illusion of safety. But this state is fragile, and substances like alcohol or opiates become both saviors and sabotagers. Alcohol, for example, temporarily releases membrane tension, relieving stress, offering fast energy. But long term, it damages healthy structures and deepens the imbalance. An integrative approach does something different. It uses herbal medicine and nutrition to reduce inflammation, to ease anxiety gently, and to reactivate the mitochondria, restoring authentic energy production, always supported by psychological work, because energy alone does not process trauma. It might be more effective than conventional drugs, because most medications suppress symptoms by shutting down mitochondrial function. They may stop inflammation, but they offer no pathway back to vitality. They don't clear the waste. They don't rebuild the membranes. They don't reconnect the field. And so fire continues to smolder, slowly showing up as chronic medication use, fluid retention, weight gain, mental fog, hormonal collapse, and degenerative diseases. The integrative path does not promise instant relief, but it offers restoration, slowly. And for many, that is the beginning of something far more powerful than relief. It is the return of the self. Pain is not an enemy. It is a messenger, sometimes distorted, sometimes desperate, but always meaningful. When we shift our focus from suppression to listening, from control to connection, something ancient begins to stir. We remember that the body is not a machine, but a living field of memory, of meaning, and of possibility. And in that field, healing is not always a cure, but often a return to the self, to trust, and to coherence. Thank you for listening. If this message resonated with you, share it with someone who may need it. And if you are walking through pain, know this: you are not broken. You are becoming whole again.